This video is about the new technique on the lobectomy, going from 4 or more ports or holes to down to 3, and then it was discovered that 2 was an option and that it was less invasive, and then the Uniport became an option. And so there was a doctor from Spain that was able to perfect it and begin to use it. The intercostal space, so the space between the ribs, there is less pressure with the Uniport than the multiple port procedures. The patient's able to go home quicker. They're awake and alert after the procedure, even 3 minutes after the procedure's completed, because they're not intubated. And so there's less risk for the patient because they're not sedated. They're able to do a block on them, and so that they're not able to feel the procedure. And so the video also talked about him going to China and to Kazan, Russia, to be able to deal with patients who had exposure to various things that caused a high frequency of, or a high incidence of lung cancer in certain areas. And so for lung cancer, lobectomy is where they remove part of the lobe of the lung. And so they have low mortality rates. About 1 to 3% of those that have had either open thoracotomy or VATS have faced fatal complications. Those are typically pneumonia and respiratory failure are the most common causes of death. The survival rate after 5 or more years for a lobectomy is 41%, and that was looking over 34 patients. After a simple pneumonectomy, 21 patients, 30% lived 5 years or more, and after a radical pneumonectomy, 39 patients, or 39%, lived 5 years or more. So this is hopeful that there is less risk for these patients, and it's increasingly important, especially to me today. I had a friend, a recent coworker, nurse practitioner, who just retired, and she just let us know today that she does have lung cancer and that it had spread. So it was encouraging to be able to read. I think this was from 2011, but to be able to read and hear about some of the progress that is being made in this area of medicine.